Well, we use our jaw a lot on any given day, right? Biting, chewing, talking. So it's important that it opens and closes correctly. When it doesn't, it's just as important to find relief. So I'd like to welcome back Dr. Sheila Shahamat from Crown Point Dental to talk about TMJ disorder and what we can do about it. Good to see you.
Good to see you too.
Okay, for those who may not be familiar, I feel like you've heard maybe that acronym TMJ before, but what exactly is it?
Well, TMJ stands for temporomandibular joint or jaw joint, which is right in front of the ears. And like any other joint, there is a disc or pad which cushions and separates the articulating surfaces. There are several muscles and ligaments that hold the jaw in place and make all the movements possible. TMJ is the most used, most complex joint in our body since we are able to open the mouth vertically, move the jaw side to side, and move the jaw forward. All the problems related to jaw and mastication muscles are called temporomandibular disorders or TMD.
Okay, so what is causing this disorder in some people?
Well, there are a lot of factors associated with jaw disorders. On top of the list, we have stress, clenching and grinding, extensive restorative treatment, aggressive orthodontics treatment, complicated oral surgery, history of trauma to the jaw, like a fall or a car accident.
Okay, so there are a lot of things that can cause you to have it, even
Yes.
later in life. It's not like it's something that's an age-related issue. It's really based on how your life is, right?
Exactly.
Okay, so what are some noticeable signs and symptoms that someone's suffering from this?
Well, there are several signs and symptoms such as headache, dizziness, facial tiredness, stiffness of the facial muscles, clicking and popping of the jaw with or without pain, opening and closing, pain that can radiate to the back, neck and shoulder, difficulty swallowing. But it's good to know that there are other conditions that have similar symptoms, such as tooth decay, sinus problems, arthritis, and even migraine.
Okay, so there are other things causing the symptoms, but none of it sounds good because these are issues that are going to affect your quality of life.
Correct.
Okay, so Dr. Shahamat, let's talk about treatments for this disorder because people obviously who suffer from it want to try and get rid of it, right?
Correct. Well, the treatment can be as simple as a bruxing guard to wear at nighttime. A guard can keep the muscles and jaw in a relaxed position, also won't let you clench or grind your teeth. Sometimes we need to add a TMJ splint for daytime that patients can wear even when they eat and chew. In more severe cases, we put the patients on pain reliever. Also, Botox can be injected into affected muscles if the problem is muscular. Although that's not a permanent cure, it's a temporary relief that lasts 8 to 12 weeks. Some believe that temporomandibular disorder can be caused by a learned behavioral response, meaning that at one point we pick up the habit of clenching and grinding subconsciously, and Botox can erase that memory and reset the muscles.
Okay, interesting.
Yeah, personally, I've had several patients that after they had the Botox injection done several times, their symptoms subsided dramatically. But it's not scientifically proven yet.
Okay, but it's something I'm sure if people are suffering for a long time, they're of the I will try anything kind of thought process.
And it's an immediate relief. The pain goes away. Again, it's not a cure, but it helps a lot for people that tried everything and nothing helped, so they can get a relief.
It's good to know there are options, though. If you have any of these symptoms, come in and see your dentist. Is that kind of the best advice that you would give?
Yes, the first step is going to your dentist or your physician for consultation and get a TMJ exam done. Also get the other conditions checked to see what exactly causing the pain and symptoms, and then go with the right treatment.
Okay, Dr. Shahamat from Crown Point Dental, thank you so much for being here.
Thank you for having me.